Let us now learn about popliteal fossa. Popliteal fossa is diamond-shaped hollow on the back of knee. You can see it is diamond-shaped. It is present on back of knee. It becomes prominent when the knee is flexed. It becomes more prominent when the knee is flexed. It provides passage for main vessels and nerves from thigh to leg. Main vessels and nerves pass from thigh to leg through popliteal fossa. Now let's see the boundaries of popliteal fossa. Superomedially, semitendinosus and semimembranosus. Superomedially, this is medial side, this is lateral side. Superomedially we have semitendinosus and semimembranosus. Superolaterally, biceps femoris. You can see superolaterally, biceps femoris. Infерomedially, medial head of gastrocnemius. You can see infерomedially, medial head of gastrocnemius. Inferolaterally, lateral head of gastrocnemius, supplemented by plantaris. Inferolaterally, lateral head of gastrocnemius, supplemented by plantaris. Superomedially, semimembranosus, semitendinosus. Superolaterally, biceps femoris. Inferomedially, medial head of gastrocnemius. Inferolaterally, lateral head of gastrocnemius, supplemented by plantaris. Floor or anterior wall. Floor of popliteal fossa is formed from above downwards by popliteal surface of femur, capsule of knee joint, oblique popliteal ligament, fascia covering popliteus muscle. You can see the popliteal surface of femur, capsule of knee joint, oblique popliteal ligament. Oblique popliteal ligament is fibrous extension from tendon of semimembranosus. You can see the fascia, it is covering popliteus muscle. Fascia covering popliteus muscle is also fibrous expansion from tendon of semimembranosus. Floor is formed from above downwards by popliteal surface of femur, capsule of knee joint, oblique popliteal ligament, fascia covering popliteus muscle. Roof or posterior wall. Roof of popliteal fossa is formed by deep fascia, strong deep fascia. Over the deep fascia, superficial fascia is present. Superficial fascia contains 3 cutaneous nerves and short saphenous vein. You can see 3 cutaneous nerves here and short saphenous vein. 3 cutaneous nerves are sural communicating nerve. You can see sural communicating nerve, posterior cutaneous nerve of thigh, posterior division of medial cutaneous nerve of thigh. Remember cutaneous nerve of thigh. Posterior cutaneous nerve of thigh, medial cutaneous nerve of thigh. Medial cutaneous nerve of thigh has 2 divisions, anterior division and posterior division. Among the 2 divisions, superficial fascia contains posterior division of medial cutaneous nerve of thigh. So the superficial fascia contains posterior division of medial cutaneous nerve of thigh, posterior cutaneous nerve of thigh, short saphenous vein, sural communicating nerve. Roof of popliteal fossa is pierced by all these structures except posterior division of medial cutaneous nerve of thigh. You can see these 3 structures are piercing the facial roof, whereas the posterior division of medial cutaneous nerve of thigh is not piercing the facial roof. Contents of popliteal fossa. It contains arteries, veins, nerves, lymph nodes and fat. Arteries. Popliteal artery and its branches. Veins. Popliteal vein and its tributaries. Lymph nodes. Popliteal lymph nodes. Popliteal pad of fat. And nerves. There are 4 nerves. You can see 2 nerves here. One is tibial nerve and its branches. Common peroneal nerve and its branches. Posterior cutaneous nerve of thigh. Genicular branch of obturator nerve. Popliteal artery and its branches, popliteal vein and its tributaries, tibial nerve and its branches, common peroneal nerve and its branches, posterior cutaneous nerve of thigh, genicular branch of obturator nerve, popliteal lymph nodes, popliteal pad of fat. Relationship of tibial nerve, popliteal vein and popliteal artery in popliteal fossa. You can see in the upper part of popliteal fossa from medial to lateral. This is medial side, lateral side. From medial to lateral, A, V and structures are present. Popliteal artery, popliteal vein and tibial nerve. In the middle part and lower part, just reverse N and A. NVA from superficial to deep in middle part. You can see the most superficial is tibial nerve N. Intermediate V, popliteal V. Deep structure is popliteal artery. In the middle part, from superficial to deep, NVA, tibial nerve, popliteal vein, popliteal artery. In the lower part, NVA, from medial to lateral. From medial to lateral, tibial nerve, popliteal vein, popliteal artery. In the upper part, AVN structures. In the middle part, just reverse N and A, NVA, from superficial to deep. In the lower part, from medial to lateral, NVA. Let us now see each content in detail. Popliteal artery. Popliteal artery is continuation of femoral artery. It begins at adductor hiatus. Popliteal artery is continuation of femoral artery. It begins at adductor hiatus. Adductor hiatus is tendinous opening present in adductor magnus muscle. Adductor hiatus is present at the junction of middle one-third and lower one-third of thigh. Popliteal artery is continuation of femoral artery. It begins at adductor hiatus. Popliteal artery crosses floor of popliteal fossa from medial to lateral side. This is medial side of the popliteal fossa, lateral side of the popliteal fossa. Popliteal artery crosses the floor of the popliteal fossa from medial to lateral side. At the lower border of popliteus, it terminates by dividing into anterior and posterior tibial arteries. This is popliteus muscle. At the lower border of popliteus muscle, popliteal artery divides into anterior tibial artery and posterior tibial artery. Relations of popliteal artery. Anterior or deep relations. Popliteal artery lies just above the floor of the popliteal fossa. Popliteal artery is deepest structure. Hence, the deep relations of popliteal artery is formed by floor of popliteal fossa. Superficial relations of popliteal artery are popliteal with tibial nerve. Medial and lateral relations of popliteal artery. Medial relations in upper part, semimembranosus muscle, semimembranosus and medial condyle of femur. Lateral relations in upper part, biceps femoris and lateral condyle of femur. Medial condyle of femur, lateral condyle of femur. Semimembranosus, biceps femoris. Medial relations in lower part. Popliteal artery, medial relations in lower part. Medial head of gastrocnemius, tibial nerve, popliteal vein. Medial head of gastrocnemius, tibial nerve, popliteal vein forms the medial relations of popliteal artery in the lower part. Lateral relations of popliteal artery in the lower part are plantaris, lateral head of gastrocnemius. Plantaris, lateral head of gastrocnemius. Branches of popliteal artery. Popliteal artery gives cutaneous branches, muscular branches, genicular branches. Muscular branches. Upper muscular branches supply hamstring muscles and adductor magnus. Lower muscular branches supply gastrocnemius, soleus and plantaris. Genicular branches. Popliteal artery gives 5 genicular branches. Superior medial genicular artery, superior lateral genicular artery, inferior medial genicular artery, inferior lateral genicular artery and middle genicular artery. Superior medial and lateral genicular arteries wind around corresponding sides of femur immediately above corresponding femoral condyles. Superior medial genicular artery winds around medial side of femur just above medial condyle of femur. They lie deep to hamstring muscles. Middle genicular artery, it pierces oblique popliteal ligament and supplies cruciate ligaments and synovial membrane of knee joint. Inferior medial and lateral genicular arteries, inferior medial and inferior lateral genicular arteries wind around corresponding tibial condyles. They pass deep to collateral ligaments. You can see the collateral ligaments of the knee joint. Inferior medial and lateral genicular arteries pass deep to collateral ligaments of the knee joint. Genicular branches take part in arterial anastomosis around knee joint. Popliteal vein. It begins at the lower border of popliteus by the union of anterior tibial vein and posterior tibial vein. Popliteal vein is formed at the lower border of popliteus. It is formed by the union of anterior tibial vein and posterior tibial vein. Popliteal vein ascends superficial to popliteal artery. Popliteal vein ascends, it passes upwards, superficial to popliteal artery. Popliteal vein ascends superficial to popliteal artery. In the lower part of fossa, Popliteal vein lies medial to popliteal artery. This is medial side, this is lateral side. In the lower part, popliteal vein lies medial to popliteal artery. In the middle part, popliteal vein lies superficial to popliteal artery. In the upper part, popliteal vein lies posterolateral to popliteal artery. You can see it is lying lateral. Popliteal vein continues as femoral vein at adductor hiatus. Popliteal vein continues as femoral vein at adductor hiatus. Tributaries of popliteal vein: short saphenous vein or small saphenous vein, short saphenous vein or small saphenous vein. It is draining into popliteal vein. Veins corresponding to the branches of popliteal artery. Vena comitans of anterior tibial artery and posterior tibial artery. Tibial nerve. Root valley of tibial nerve. Ventral divisions of ventral rami of L4, L5, S1, S2, S3. Sciatic nerve divides into tibial nerve and common peroneal nerve. Tibial nerve is the larger terminal branch of sciatic nerve. Tibial nerve is larger terminal branch of sciatic nerve. Tibial nerve lies superficial to popliteal vessels. It extends from superior angle to inferior angle of the popliteal fossa. You can see the tibial nerve. It is extending from superior angle to inferior angle of the popliteal fossa. It crosses popliteal vessels from lateral to medial side. This is lateral side, medial side. Tibial nerve is crossing popliteal vessels from lateral to medial side. You can see in the upper part, popliteal vessels, tibial nerve. Tibial nerve is lying lateral to popliteal vessels, whereas in the lower part, tibial nerve lies medial to popliteal vessels. Tibial nerve crosses the popliteal vessels from lateral to medial side. It continues in the back of leg. Tibial nerve continues in the back of leg. Branches of tibial nerve. It gives cutaneous branches, genicular branches, and muscular branches. Cutaneous branch, sural nerve. You can see the cutaneous branch, sural nerve. Sural nerve. Sural nerve originates in the middle of the fossa. You can see the sural nerve. It arises near the middle of the fossa. It supplies skin of lower half of back of the leg. It supplies skin of lower half of back of leg. And it supplies whole of the lateral border of the foot till the tip of little toe. Genicular branches. It gives three genicular branches: superior, middle, and inferior. Medial genicular nerve, middle genicular nerve, and inferior medial genicular nerve. Superior medial genicular nerve lies above medial femoral condyle. Middle genicular nerve, it pierces the posterior part of capsule of knee joint. Inferior genicular nerve, it passes along the upper border of popliteus and it reaches inferior to medial femoral condyle. Muscular branches. Muscular branches arise in the distal part of the fossa. It supplies medial and lateral head of gastrocnemius, plantaris, soleus, and popliteus. It supplies popliteus through nerve to popliteus. Gastrocnemius, medial head, lateral head. Plantaris, soleus. Popliteus, it also supplies popliteus through nerve to popliteus. Nerve to popliteus supplies popliteus, superior and inferior tibiofibular joints. Superior tibiofibular joint and inferior tibiofibular joint. Interosseous membrane. Interosseous membrane. Tibialis posterior and tibia. Nerve to popliteus supplies popliteus, superior tibiofibular joint, inferior tibiofibular joint, interosseous membrane, tibialis posterior, and tibia. If you observe here, all the muscular branches of tibial nerve arise from the lateral side except nerve to medial head of gastrocnemius. It arises from medial side of the tibial nerve. Hence, the lateral side of the tibial nerve is surgically unsafe, whereas the medial side is surgically safe. As more number of muscular branches arising from the lateral side of the tibial nerve, it is surgically unsafe. Common peroneal nerve. Root value of common peroneal nerve. Dorsal divisions of ventral rami of L4, L5, S1, S2. Sciatic nerve divides to give tibial nerve and common peroneal nerve. Common peroneal nerve is smaller terminal branch of sciatic nerve. It lies in same superficial plane as that of tibial nerve. It extends from superior angle to lateral angle of popliteal fossa along the medial border of biceps femoris. It extends from superior angle to lateral angle of the popliteal fossa along the medial border of biceps femoris. It passes superficial to plantaris and lateral head of gastrocnemius. Common peroneal nerve passes superficial to plantaris and lateral head of gastrocnemius. It passes downwards and forwards to wind around neck of the fibula. Here it divides into superficial and deep branches. Superficial peroneal nerve and deep peroneal nerve. Branches of common peroneal nerve. In the popliteal fossa, it gives two cutaneous branches and three genicular branches. Three genicular branches are superior lateral genicular nerve, inferior lateral genicular nerve, recurrent genicular nerve. Superior lateral genicular nerve lies above lateral condyle of femur. Inferior lateral genicular nerve lies above the head of the fibula. This is head of the fibula. Inferior lateral genicular nerve lies above the head of the fibula. Recurrent genicular nerve. It arises where common peroneal nerve divides into superficial peroneal nerve and deep peroneal nerve. It ascends anterior to knee joint and supplies tibialis anterior muscle in addition to knee joint. It supplies tibialis anterior muscle. Nerve. Common peroneal nerve gives two cutaneous branches, sural communicating nerve, lateral cutaneous nerve of cough. Sural communicating nerve arises opposite to the head of the fibula. It crosses superficially to lateral head of gastrocnemius. Sural communicating nerve arises opposite to the head of fibula. It passes superficial to lateral head of gastrocnemius and then joins sural nerve. Lateral cutaneous nerve of cough. It supplies skin on upper part of lateral side of leg. It supplies lateral side of leg. Upper part of lateral side of leg. Genicular branch of obturator nerve. It is continuation of posterior division of obturator nerve. You can see this is posterior division of obturator nerve. Genicular branch is continuation of posterior division of obturator nerve. It pierces oblique popliteal ligament. It supplies capsule of knee joint. Posterior cutaneous nerve of thigh. It is content of upper half of popliteal fossa. It pierces deep fascia. Posterior cutaneous nerve of thigh is a content of upper part of popliteal fossa. It pierces the deep fascia and supplies the skin up to middle of back of the leg. Popliteal lymph nodes. Popliteal lymph nodes lies deep to deep fascia. They lie deep to deep fascia. They lie near termination of short saphenous vein. Popliteal lymph nodes receive afferents from lateral part of sole, back of leg, knee joint. Its efferents end in deep inguinal lymph nodes. Lateral part of sole, back of leg, knee joint. Efferents end in deep inguinal lymph nodes. Let us now revise popliteal fossa. Boundaries of popliteal fossa. Superomedially, semimembranosus and semitendinosus. Superolaterally, biceps femoris. Inferiormedially, medial head of gastrocnemius. Inferolaterally, lateral head of gastrocnemius supplemented by plantaris. Floor. It is formed by popliteal surface of femur, capsule of knee joint, oblique popliteal ligament, fascia covering popliteus muscle. Roof. It is formed by deep fascia. Over the deep fascia, superficial fascia is present. It contains three cutaneous nerves and short saphenous vein. Three cutaneous nerves are posterior cutaneous nerve of thigh, posterior division of medial cutaneous nerve of thigh, and sural communicating nerve. Contents of popliteal fossa: popliteal artery and its branches, popliteal vein and its tributaries, popliteal lymph nodes, popliteal pad of fat. Nerves. Four nerves: tibial nerve, common peroneal nerve, posterior cutaneous nerve of thigh, and genicular branch of obturator nerve. Popliteal artery, it gives cutaneous branches, muscular branches, and five genicular branches. Five genicular branches: superior, medial, and lateral genicular arteries, middle genicular artery, inferior, middle, and lateral genicular arteries. Tributaries of popliteal vein: short saphenous vein, veins corresponding to the branches of popliteal artery, neck emptiness of anterior and posterior tibial arteries. Tibial nerve, it gives cutaneous branch, sural nerve, muscular branches. It supplies gastrocnemius, medial and lateral heads, plantaris, soleus, and popliteus. It supplies popliteus through nerve to popliteus. It also gives three genicular branches, superior and inferior medial genicular branches, and middle genicular branch. Common peroneal nerve. It gives two cutaneous branches, sural communicating nerve, lateral cutaneous nerve of cough, three genicular branches, superior and inferior, lateral genicular branches, and recurrent genicular nerve. Posterior cutaneous nerve of thigh supplies skin up to middle of back of leg. Genicular branch of obturator nerve. It is the continuation of posterior division of obturator nerve. Supplies the capsule of knee joint.